Yes, ACT is essentially COVID-free, and being a resident at the moment of ACT, we're all encouraged. And I think those are the figures we want to see sustained. That's what we want to maintain. We want to see that complete flattening of the curve, and that's why we're really staying really focused on all of those three aspects that we need to have.
You said 3.13 million people had signed up to...
Sorry, and that's my mistake. It's 3.31 million. Got my numbers muddled up.
I guess my question is that enough? That would mean something like 1 in 8 or 1 in 9 people you run into within 1.5 minutes or 15 minutes has the app. How many cases will that actually help you be able to contact trace on?
As we've said, everyone who downloads and registers for this app is one more that will help us in this fight. As we said, we don't know anything about who's registered, where they've registered, or when they're registered. So those are information that we chose not to be able to have to protect the security of this system. So we are still encouraging more people. We have low numbers at the moment too, remember? So that is really encouraging as well. So we've seen only 10 new cases in the last 24 hours, but every one of those cases hopefully will be able to track quicker and get on top of any outbreak before it happens.
Domestic travel, when do you see domestic travel resuming, and what restrictions could be placed on things like planes and trains and motor transport?
So the decision about the easing of restrictions is, of course, the decision of the National Cabinet. Interstate travel has not ceased completely. We do know that between some jurisdictions you can travel. There are flights still available, or you can drive. I think the decisions will be made as we monitor and consider what we're seeing across the country. If we see those sustained flattening of the curve, then those restrictions will ease. But we don't want to rush into anything, because we want to be able to understand, as we take steps along the way, what are those impacts we're seeing on the number of cases across the country.
Would planes be exempt from social distancing, things like that 1.5 metres, or how do you manage that moving forward?
I think the things that we are emphasising around travel and all of the aspects of moving around are, firstly, we want to make sure that no one who is unwell is leaving home. We're asking them to stay at home. And then we will ask them to follow those social distancing requirements. It's pretty hard to do sometimes on a plane, but as I understand, those flights that are going, they're trying to maintain as much distance between passengers as they can, and again, making sure no one who's unwell gets on, making sure that you maintain hand hygiene and cough etiquette, those type of things. They're important safeguards for us all, so we don't see any spread of COVID-19 across the system.
Just on the Tasmanian cluster and the interim report that's come out today into that, it found that some health workers continue to go to work despite having mild symptoms. Is there a feeling in the health workforce at the moment that they need to press on even if they are feeling 100%? And what's the message to those workers?
So I think the really strong message to everybody, but particularly those working with the most vulnerable, which is those working in the health and aged care sector, is please be very vigilant about any minor or slight symptoms you might have, a scratchy throat, a little bit of a runny nose. Testing is available out there readily to everyone. So if you're at all concerned that you might have symptoms, please don't go to work. Please seek guidance from your GP or from a testing clinic, and let's confirm that you're COVID-free. Let's not put anybody in our community at risk, and we're encouraging that across our workforce.
Should aged care operators be forced to allow visitors, or are there legitimate concerns that justify lockdowns to prevent coronavirus from getting into facilities that don't have enough staff that need it?
The advice of the AHPPC has not changed, that there are really important measures that aged care facilities need to put in place to protect those most vulnerable. But that does not necessitate the need to completely lock down a facility. As long as they take those important steps and they control and follow the advice we've provided to them about visitors, then we believe visitation is an important part of the well-being of those in a residential aged care facility, and we want to see wherever possible they can get those visitations. Each facility needs to take their circumstances into consideration, and there may be times, if there is an outbreak, that lockdown and a complete prevention of visitation will be necessary, but we are encouraging facilities to think about how they'll maintain the well-being of their residents through controlled visitation, making sure they can keep connected with their family because it's so important to their well-being.